A shocking health alert has shaken Cape Cod. A swimmer recently contracted a rare and potentially dangerous infection right at one of the region's most popular beaches. If you thought summer dips in the ocean were only about sun and surf, think again. Sometimes there's much more lurking beneath the surface. Here's what happened. The Massachusetts Department of Public Health is urging locals and tourists to exercise extra caution after an individual developed a case of Vibriosis, an uncommon but serious infection, after swimming at Old Silver Beach in Falmouth. What's particularly alarming is that the swimmer had an open wound when they entered the water. The person, known only as an older adult, is currently dealing with an unknown health status, which only adds to the public's concern. But here's the twist. Even after this disturbing incident, there's no official advisory or closure for Old Silver Beach. So, should you avoid the water, or is the risk small enough to keep business as usual? The debate is already sparking strong opinions among local residents and beach lovers. To help everyone make informed decisions, the Falmouth Health Department is spreading the word about what's going on and what you can do to protect yourself. So far this year, Massachusetts has reported 71 potential or confirmed cases of Vibriosis, and nearly 1/3 of those infected required hospital care. The good news? There have been no deaths from these recorded cases in 2024. And this is the part most people miss. Most Vibriosis infections in Massachusetts haven't come from swimming, but from eating shellfish that had been contaminated with the bacteria. Between 2015 and 2024, the vast majority of those sickened caught Vibrio from raw or undercooked seafood, not from swimming with cups and scrapes. Should this shift the way we view the risks of a beach day versus a plate of oysters? Here's what everyone needs to know about Vibrio bacteria. According to experts at the Centers for Disease Control and Prevention, CDC, Vibrio flourishes in warm salt water, as well as brackish water, a blend of fresh and salt water. These bacteria thrive during the warmer months, typically reaching their highest concentrations from May to October. If you have any kind of open wound, including recent scratches, surgery incisions, new piercings, or tattoos, the medical advice is clear. Stay out of the ocean and brackish water. Why? Vibriosis is rare, but it can be extremely dangerous, particularly for people with weakened immune defenses or chronic illnesses. In severe cases, it can trigger sepsis, a potentially fatal condition where the body dramatically overreacts to infection. Curious about how these infections happen? Vibrio typically enters the body one of two ways: through open wounds exposed to seawater or by eating seafood that hasn't been cooked thoroughly. The symptoms can look like an ordinary stomach bug: nausea, vomiting, fever, chills, but can also include headaches, painful swelling of wounds, stomach cramps, and even diarrhea that is either watery or bloody. Most healthy people recover fully, but infections can be much more dangerous for those with certain risk factors. Who should be most concerned? If you have liver disease, diabetes, cancer, HIV, thalassemia, suppressed immunity due to treatment, or you're taking medicines that reduce stomach acid or have had stomach surgery recently, you may face greater risk and should take extra precautions. The top recommendation: avoid contact with seawater or brackish water if you have an open wound. But if that isn't possible, be proactive. If you get a cut while in the water, get out right away. Wash all wounds thoroughly with clean water after ocean or brackish water contact. Cover wounds with waterproof bandages if there's any chance they'll be exposed. If you notice signs of infection, such as redness, swelling, or pain, seek medical care immediately. This warning comes just over a year after a tragic case in Rhode Island, where a resident died from a similar Vibrio infection. Does that mean these rare incidents are becoming more common, or are we just paying closer attention now? So the big question: should beaches be more strictly monitored, Or would shutting them down be an overreaction? Is the real public health risk on the sand and in the water? Or is it actually at the seafood bar? We want to know what you think. Are you skipping beach days, steering clear of raw oysters, or not worried at all? Let us know your thoughts in the comments, especially if you have your own experience or advice to share. Your perspective might change someone's summer plans or even help keep them healthy.